I'm Ron Williams, the minister. I have here Dr. Michael Zucker, a retired alternative medicine doctor who now consults on chronic disorders.
Thanks for bringing me here.
Doctor, so many people have some kind of chronic disorder in their gastrointestinal system. How do you sort them all out?
Well, it is a little bit tricky, but as I say, everybody's got guts. By that we mean things where the food goes in and gets converted into something and then it ends up going out you know where. So there are a lot of parts to this area. Now, it starts actually in the mouth and it goes down through the esophagus, the tube going from the throat down into the chest and then into the stomach. And then it empties into the small intestine, then the large intestine, and out through the anus. Now, there are a lot of functions in this area, this big area. A lot of them are digestive, obviously. After all, the whole purpose of this long tube is to get food in and convert it into energy or building blocks you need. So we need to understand the different parts a bit as to what they do. You probably know with the colon, it's a large intestine, and it moves the materials forward after digestion, and it ends up putting them out. Now, in doing so, it absorbs a bunch of water, and we need fiber in order to help that move forward. The stomach, of course, is where you mix a bunch of things you've eaten, and you get the secretion of hydrochloric acid there. It starts the breakdown of protein. The small intestine gets secretions from the liver and gallbladder, and it also receives secretions from the pancreas, digestive enzymes, such that you can break down the carbohydrate, protein, and fat, and then absorb it. So that's what these functions are. And there are a lot of different things going on in different areas. So when a person has a difficulty with the intestines or stomach or pain in the abdomen, pain in the pelvis, problem with getting rid of the stool, we have to try to, first of all, understand where the problem lies. Now, as a holistic type of doctor, we don't really function as organ repair people, particularly. We're more interested in what went wrong, what's the cause of the trouble. If we can find the cause, then we can put in a program to shut that down or at least reduce the problem. So we don't just make diagnoses from x-rays, lab tests, even physical diagnosis often, examination, that means. We really take a careful history, and the history tells proper tale. If you take a careful history, you generally have a fairly good idea of where the problem is located and maybe what exactly that is even. In the intestinal tract, there are a lot of things that could be wrong, and therefore we have to find out where, and then we can do a trial of therapy in order to see if that's the actual cause and will relieve the trouble. So unlike other areas, we generally are able to kind of go down like a flow sheet. We try the most likely thing, then the second, and the third if we need to. And at some point, we're going to hit on what actually is causing the trouble and what we have to do. But it can take a little while. The nice thing about that is that we can pretty much say that we'll have almost 100% elimination of the problem if we follow it all the way down to the end. That's very nice. That's better than in a lot of other conditions we have to deal with.
Nowadays, it seems like doctors have little time for a good history taking.
Well, that's unfortunate. That's very unfortunate. My father was a medical doctor, and he taught me certain things. And one thing he said to me was, listen to the patient. He's telling you the diagnosis. And that's generally true, but you have to know what questions to ask. So I do a very detailed environmental history. In other words, looking at all possible areas that could be affecting the system and stressing it and causing the processes to not work correctly. And eventually, if not handled, we get organs that fail.
Well, once you find the area of trouble, what do you do for it?
Well, unlike the standard doctor approach, we're not in a big hurry to give a lot of drugs. After all, drugs don't correct what is going on, the process, in general. Occasionally they will, but generally drugs deal with symptoms, the way you feel, complaints. So what we really need to start with is what caused the system to go out of balance and develop symptoms and trouble. Now, there are a lot of diets out there. Obviously, we're talking about the gastrointestinal system, so we have to deal with nutrition and what goes in. I am not into fad diets. I think that the best thing is to have a diet that tends to quiet down the system and correct imbalances and over secretion, overactivity, spasm, things that cause discomfort. I have a particular diet, and I've written a book called Health Truth, a rather lengthy book, contains everything I know. And in it, I discuss what I call the quiet diet. And the quiet diet is just that. It calms everything down because people in this country are mostly overstimulated due to various factors. It might be emotional stress, it might be chemicals that get in the system, it might be things they're putting in their diet, such as, for instance, caffeine, alcohol, very heavy spice. There are various things that can cause disturbance. So we try to reduce these factors, and we give some ideas of what important good things to put in their place. And over a period of some weeks, generally, there's considerable improvement in whatever symptoms might be present, but not always. Sometimes you have to actually put something in that's missing, such as a digestive enzyme or product. Now, we also work towards detoxification. We live in a very chemical-oriented society, and people pile up stuff without knowing it. And you know, there are a lot of these things actually get in the food supply. Now, if you eat organic, of course, this is better. And a quiet diet emphasizes, first of all, pure foods. That means organic, preferably. And secondarily, raw foods. The body needs raw factors because it is raw and alive. And the third thing is whole foods. And the fourth thing is fresh foods. And in moderation as tolerated, to account for things like blood sugar troubles or food allergies, etc. So if you follow those 6 letters, PRWF, that's the proof that this thing will work. So this is pretty much how I start in on a case. And as I go along with my little flow sheet of figuring out what's what, then I will put in supplements, which will give materials the body needs that it can't get from the food supply, as well as important factors that may help it do a little better. These may be digestive products, may be things called probiotics, acidophilus and other germs that actually help the intestine work better, the large intestine particularly. Very important for the immune system. And there are other things that can be used, but these are the main things we start with. As we do our testing of special types, we may find that there are some other areas of trouble, and then we put in a fix for that as well. There is a place for drugs, but I don't reach for them as the first solution.
Well, that makes sense. Do you prescribe drugs then?
I do not actually prescribe anymore. I let my medical license expire over 10 years ago. And I felt that it was too much trouble struggling with the modern medical system and the disagreements with it. So I am a drugless practitioner. And I find that I can still get the same results on almost all the cases without prescribing drugs. And it's actually much healthier for the system because drugs are chemicals and they do still reside in tissues even once you're done pretty much with taking them. So the less the better. And I've found over the 40 years of practice that people who come to me, and it's always for chronic disorders, they end up taking half or less of the amount of drugs, and often they can get off drugs. So that's, I think, a pretty good result.
How do you view ulcer disease?
Well, ulcer disease is a problem of inflammation of some kind. It may be inflammation due to autoimmune disorders. It may be due to an infection in the stomach, for instance. We used to have a lot of trouble with ulcer disease. A lot of surgery was done about it. And now we know that that was a very bad mistake. There was some crazy guy out there who was saying, hey, this isn't just too much acid secretion and it's eating away the stomach lining or the intestine. This is an infection. And everyone laughed. Well, it turns out the guy was right. So that shows you sometimes what's held as absolute truth in the medical establishment turns out to be just the opposite. My book talks about that kind of problem quite a bit. Now, there's a lot of suppression in terms of information that we get. And there's actually a concerted effort to keep people sick, unfortunately. And it makes a ton of money for people in what I call the medical industrial complex. This is a $5 trillion a year operation in the United States alone, biggest business there is. So it's carefully guarded. In any case, I use quite a bit of supplements instead of drugs. And inflammation is very common in the stomach and to some degree the esophagus above it. Right now there's a big craze about taking drugs to stop stomach acid so that it won't go backwards up into the esophagus and burn it, et cetera, et cetera. We are actually on a path towards getting people on more and more drugs, and they've made this particular type of medicine over the counter even. However, when you start interfering with stomach acid, you also start interfering with absorption of minerals. So it's not exactly the best thing to do. We have the other side of it as infection in the stomach. And we know that there is a particular bacterium called Helicobacter, which actually can lead to ulcers and inflammation in the stomach or small intestine. And you cure it with antibiotics. So this is a good drug situation. But you can also cure it with something called gum mastic, which is a natural product of a plant. So there are alternatives to drugs. Now, what I do is I use this quiet diet, as I call the matter, to reduce inflammation and irritation and over secretion and contraction of the tissues. And in general, it works quite well. May not be 100%, but it often reduces it enough that we don't have to get into drugs. Now, curiously, there used to be an awful lot of stomach cancer in this country. Now there's almost none. This is very interesting, and I'm not a big fan of drugs and synthetic items. That means man-made, which we've had for now about 140 years. But we are using a fair amount of BHA and BHT in processing foods as a bit of a preservative. And this stuff is, you look at it, it's a chemical, so it's not really good for you. But on the other hand, it acts to prevent the formation of cancer in the stomach. It has antioxidant qualities, and it is no doubt responsible for the tremendous reduction in stomach cancer. So there's a particular material, a chemical used in processing, which actually has more good to it than bad. So you have to look at each thing individually.
How about in the lower intestine, as in ulcerative colitis or Crohn's disease?
Well, you've got an issue of autoimmune disease down there. And this is a very difficult problem. It used to be particularly difficult and led to quite a few deaths. At this point, we have a pretty good approach towards it with medication, but all medications, of course, have their side effects or potential toxic effects. Ulcerative colitis is a disease at the end of the colon. It doesn't go up in the higher areas. And it causes a lot of bowel complaints and abnormalities with bowel movements. And it can make a person very sick because it's attacking the lining of the lower intestine and eating it away. Crohn's disease is similar in many ways, but a little different. It makes ulcers in various places in the intestinal tract. And it can make abscesses, which are pockets of serious infection. So I've given a lot of medication, including steroids, cortisone medication for these conditions when they're red hot. But there should also be the approach towards elimination of the problem, not just control. And we can do this to a certain extent in these disorders with the dietary approach we've discussed. I've actually cured a number of cases of earlier ulcerative colitis just with dietary approaches. Crohn's disease is a little tougher, but it does respond. And it's interesting that a certain number of these cases of both diseases are due to food allergy. And so if you could identify that, you could actually get rid of it. So that's pretty much it for the drugs versus supplements and alternative approach. And I think that one should try the alternative first, unless a person is extremely sick.
Are you in favor of colonoscoping for everyone?
Well, this is a fad of a sort in recent years. When I was in training, we used a rigid scope to put up the anus, and we could look about 1 foot up there and see what was there. It was quite useful, but a very uncomfortable procedure. And then along came this wonderful colon scope, which can go all the way up and around, all the way 3 feet, 4 feet, 5 feet, and even into the small intestines, last portion. And this is wonderful for being able to see what's there and deal with it. However, it is an expensive and uncomfortable procedure with a lot of preparation. And even when I was in my early training, there was a movement afoot to have everybody have a sigmoidoscope exam, which is the rigid scope that looks up about 1.5 feet. But when the numbers were crunched, it was found that if everybody were to do that, there wouldn't be any doctors left to do any other medicine. So when you look at the actual numbers and the amount of good that's done, it's a little bit difficult to say everybody should just go get these things done. It's very expensive for our national budget, and it's also expensive for the individual, even if you have insurance. Somebody is paying for this, and we all pay for this. Now, the colonoscope does some good things. It can find polyps, and polyps are a precursor in many cases to development of colon cancer. However, the cause of polyps is really the issue. And fundamentally, it's due to toxic, irritating materials that are sitting in the colon too long, as in constipation, or in people who have a very low fiber diet. They secrete bile. Bile from the liver helps to enable you to absorb your fats. However, some of these bile salts are actually toxic, and they irritate the colon. So if they sit around too long, you get the reaction of the colon lining. You start to develop too much tissue buildup, and this is called polyp formation. And if you keep on irritating this area, it can then transform gradually into a cancer. So the idea is to put the scope up there and find these and remove them, and that's all well and good. However, I believe that you can get in there and stop this toxic bowel process with a good diet. And there is a place here for fasting, therapeutic fasting. I've done many fasts myself. It's pretty miraculous what happens. But if supervised and over a week long, you can actually get the body to scavenge these growths and bumps of all kinds and make them disappear. It's pretty amazing. Not a lot of fun necessarily, but it is very, very therapeutic and valuable. And it can actually, I feel, replace a lot of the colon scoping that goes on. I, for one, have refused to have colon scoping.
What about reflux disease? So common now.
Well, I talked a little bit about the problem of the esophagus being irritated if stomach acid gets up there. The first thing to understand is that there's an issue of inflammation, which can cause trouble and irritate the esophagus and cause reflux. However, probably a bigger issue is spasm. Spasm is muscle contraction. You know, there's too much activity. Well, when people say that they have this GERD, reflux disease, where stuff goes from the stomach up into the esophagus and burns it, and in many cases, that's not really what's happening. Mostly, they're having heartburn, which is that kind of spasm in the esophagus. It can be hard to decide what it is. Sometimes it comes on very intense and feels like a heart attack. You have to go in the hospital for a couple of days. Anyway, I think that there's a big rush to use drugs to control this without deciding whether it's spasm or inflammation. Now, there's also a condition called a hiatal hernia. This is a little bit of stomach that ends up being pulled up and sitting in the chest cavity. And that makes some troubles, and things can go backwards more easily there. So you have to try and identify what's going on via good history, by x-rays, by scoping the upper intestine area, which can be very valuable as well. You can do lab tests and other things also. Now, supplements do play a good role in quieting things down, and I think that that's part of a good nutritional program here.
Do you have an effective program for indigestion or gas?
I think there's a pretty good program. The first thing to understand is that if you have a lot of gas and you bloat up, what it means is you've swallowed air, or you're not digesting the food, and the bacteria down there are digesting it instead. They make gas. So it's a matter of, does your gas smell bad? That's from swallowing air. Or is this a problem of indigestion of whichever kind of food? There are ways through history of getting a fair idea of which this might be. There are a number of things that can help, for instance, if it's a lack of digestion. First of all, one should try to have some degree of relaxation when one eats. We tend to be in a big hurry all the time and eat on the run, etc. And we eat highly processed food, which is harder to digest. But if one allows the food that's taken in to be exposed to the digestive secretions in the right timing, the synchronization, you have the best chance for digestion. If you need certain supplements to help with digesting things, well, that can certainly be done, and it makes a big difference. As far as the problem of what to do about the gas, if you can find out whether there's a food allergy which can bring it on, or whether a person is excessively constipated and needs fiber, these are approaches that can be used and tend to reduce the overall gas problem. But the number one thing I would say is getting the system to be more relaxed. Combining the foods properly can also be very valuable. There are certain suggested rules. I think there are a couple of important ones. I don't think anybody should go whole hog into all these complicated programs and end up, eating just vegetables with a little bit of meat or fish once in a while. That's a little bit too difficult to maintain over time. But it can be very valuable in certain circumstances when used as a modified approach.
What about food allergies?
Well, food allergies are more common than people might expect. And ones that affect the intestinal system and stomach are pretty common. and even affect the gallbladder sometimes. And the trick is, when do you decide that there might be an allergic problem? Most people don't just come out and say, "Oh, I noticed that when I eat corn, I get diarrhea." I had a patient that had that exact problem. But usually it's a bit of a detective work, and the history is important, and then you can do certain trials of elimination. There are certain kinds of test procedures that can be done in an office. I used to do something called provocation neutralization testing, where you give a dose of a particular food or some pollen or a chemical even, and you use a certain low dose and you see what happens in the skin or under the tongue. And then you watch for a reaction. If nothing happens, you use a little stronger. You try to provoke a reaction because, and this is very interesting, it's kind of magical. If you can give a lower dose than one that caused the reaction, and you keep going lower until it knocks out the reaction by some kind of energy blockade, then that can be used as a treatment, as made up with drugs, made up with an extract of a particular food or chemical, whatever, in the right dosage, and you can put it under your tongue before you eat something, and it might be trouble, or after you've eaten something and have a reaction because it will neutralize it. Now, this is a very excellent approach, but it is an office approach, basically. And it's frowned on by the standard allergists and immunologists. They used to insist that it's not an immune problem, but it is. There are certain things in the blood which do react and cause the trouble. Now, we can also do some other things at home. Food challenge testing can be very valuable, where you have the professional sets up a list of what to challenge by eating it from day to day, and how to interpret results and chart them. And done very carefully, this is really the gold standard because it tests directly. You eat something, do you react or not? It's very valuable, and I've used it quite a few times with good effect. It's also possible to actually measure certain things in the blood, as I mentioned, which are reactive against these foods or chemicals or pollens, whatever. I'm not a big fan of fads, and there are quite a few fads concerning diet and foods and allergy. Right now, we're in the midst of a rather prolonged anti-gluten approach. I don't know if this will really pan out in the long run, but we've also had lots of other things, such as blood type diet, which I think is not really scientific or particularly effective. And we've had all kinds of other diets, food for health diet. There were various things based on raw foods, etc., macrobiotic diet. They have some validity, but they're usually pushed as the solution to everything. And I think that's not correct. Even the quiet diet is not a solution to everything, but it's a good starting point.
So much to consider.
Yes, the gastrointestinal system is quite a long and complex area. But as I said, if you persist in a good history and diagnostic approach, followed by trials of therapy, kind of flow sheet, you go down the list, generally you'll get just about 100% removal of the problem. I think that's pretty good. Well, thanks a lot for listening.